Namaste, everyone, and welcome to this explainer. Okay, let's dive right in because today we are focusing on the ultimate hospital lifesaver, the crash cart. If you're working on a ward, boss, this is one piece of equipment you absolutely must know by heart. No excuses.
Section 1. Every second counts.
See, in an emergency, we absolutely do not have time to think. When a code is called, you cannot be running here and there searching for supplies. Every single second is precious, and it can literally mean the difference between life and death for your patient. You have to act fast. And this brings us to our golden formula. Be prepared, be fast, and save lives. For all the junior doctors and nursing staff tuning in, I want you to burn this into your mind. This is the core mindset required on the ward. Without prep, you can't be fast, and you definitely can't save that life. So here is your ultimate weapon. The complete crash cart. What makes this trolley so special is that it keeps every single critical tool in one exact geography. From oxygen to those heavy-duty emergency drugs, everything is right where it needs to be. It guarantees the medical team can take immediate action without any confusion whatsoever. Section 2. Airway and breathing drawers. Okay, we're going to do a proper top-to-bottom tour now, and the crucial thing to remember is if a patient cannot breathe, nothing else matters, right? That's exactly why Drawer 1 is dedicated to the airway. It clears the path. Inside, you've got your oral and nasal airways to keep the passage open, laryngoscopes and endotracheal tubes for intubation, the ambu bag for giving manual breaths, and a suction apparatus. But listen, I need to issue a strict reminder here. Always check your ET tube sizes and make sure that suction machine is actually working before an emergency happens. Moving seamlessly down to the second drawer, breathing. Once the airway is clear, you need to deliver crucial oxygen directly to the lungs. This drawer packs your oxygen cylinder with a flow meter, different oxygen masks, simple Venturi non-rebreathing masks, a pulse oximeter to quickly check those O2 levels, and a nebulizer set for urgent medication. Section 3, circulation and emergency drugs. Right, airway and breathing are sorted. Now we shift our focus downwards to circulation. When a heartbeat stops or BP suddenly drops, Drawer 3 provides the exact machinery to restart and monitor the whole system. You've got the ECG machine and defibrillator right there to check the rhythm and shock if needed. It also holds the BP apparatus, stethoscope, IV cannulas, syringes from 2 all the way up to 20 ml, and a tourniquet for tying off and finding those tricky veins quickly. Now this is really interesting. Here's a brilliant memory trick for what is arguably the toughest part of the cart, the emergency medicines. When alarms are ringing, it's easy to freeze up, isn't it? So just remember this quick trick. A at a time, D doc saves lives. That little trick helps you pull up the heavy hitters in Drawer 4. The A's give you adrenaline and atropine for boosting heart rate, amiodarone for rhythms, and adenosine. The D's cover dopamine and dobutamine for blood pressure. You've also got magnesium sulfate, calcium gluconate, hydrocortisone, and nitroglycerin for chest pain. And please, boss, a firm warning to everyone watching. Checking the expiry dates on these drugs is non-negotiable. You absolutely cannot administer expired life-saving drugs.
Section 4. IV access and miscellaneous.
Let's guide ourselves down to the bottom sections now. Drawer 5 is totally vital for IV access and fluids. When a patient is crashing, you often have to rapidly replenish water and salts in their body. So here, you'll find normal saline and ringer lactate, 5% dextrose for maintaining sugar levels, the infusion sets to actually hang the bottles, and varied gauge needles from 16G up to 22G for different vein sizes. And right at the very bottom, we have the miscellaneous drawer. Now, this contains basic yet completely indispensable items that you just cannot do without during an emergency. We're talking gloves, scissors for cutting tape or clothes, a flashlight to check pupil responses, a thermometer, and a writing pad to note down the exact time medications were given. Section 5. Master the memory tricks. So how do you actually remember all this during a chaotic code blue? The magic phrase is ABCD, I'm safe. Let's break it down sequentially, and you'll see how brilliantly this maps out the top-to-bottom tour we just did. A is for airway at the top, B is breathing, C is circulation, D is for drugs, I is for IV access and fluids, and M is for miscellaneous at the bottom. Easy, right? Now for the second half of the acronym, SAFE. S means stay prepared, A means act fast, F is for focus, and E is for ensure life safety. This isn't just some memory trick for equipment, This is the ultimate mindset for any junior doctor or nurse on duty. If you internalize ABCD, I am safe, you are 100% ready for action. Section 6. Prepare today, save tomorrow. This brings us to the final, and honestly, the most crucial daily duty on the ward. You must follow this strict 3-step daily routine. Step 1. Check the cart daily. Step 2. Ensure everything is in its exact place, not just thrown in randomly, okay? Step 3. Verify that absolutely nothing is expired. Listen, boss, an outdated or unorganized cart is completely useless in a real emergency. You'll just be wasting precious time. And that leads perfectly into our core philosophy. Prepare today, save tomorrow. Doing the hard, routine work properly today, checking those expiry dates, making sure the suction actually works, is exactly what ensures you are fully ready to save a life tomorrow.
I want to leave you with this direct question. Is your crash cart ready to save a life today? Just take a look at it the next time you step on the ward. Be prepared, be fast, and take this responsibility seriously. Thank you so much for joining me on this explainer, and I'll see you next time.